So the question that came in on the Q&A was, what should I do for the first 3 days following a minor muscle injury? And I will begin with the caveat that I am not a physician. I am not a physical therapist. I am not going to attempt to diagnose anything. So I'm going to give you the advice that I would follow for me, assuming that this is not a more serious injury, hence the term minor muscle injury. I'll begin with telling you what I'm not going to do. Number one, I'm not going to take anti-inflammatories. It's not my thing. I believe that the inflammation process can be managed in other ways. I believe that it does not need to be stopped. I think that from what I've read and what I've learned, that the inflammatory cycle and its natural process is something that is necessary, that it sends very specific signals in order to help in the healing process. I don't want to stop that. I don't want to ice it. I don't want to ice it. I'm not going to get into that debate with people on whether you should heat or ice or not or whatever it is. And I'm not going to immobilize it. I'll tell you why. First things first, what I am going to do is I'm going to use kinesio tape. The one thing that I have learned, research, learned conversations with other practitioners, and also just what I've been taught in school, that kinesio tape is really, really good for one thing, and that's it. Despite all of its marketing, one thing. And that one thing is lymphatic drainage. Basically, it helps reduce swelling. And that doesn't sound like much, but following an injury, you're going to have swelling. And if you can not stop the swelling, but speed up the process of clearing the swelling, basically make the body more efficient in doing what it was going to be doing anyway, that sounds like a good thing. In most of what I do for my practice, I focus on being strategically lazy. I want to get a bigger return for the same amount of work, or the same amount of return for less work. Usually it's the former. So if I can put kinesio tape on an area, and that takes all of, say, 30 seconds to a minute, and while I have that on for, say, 3 to 5 days, I've sped up the amount of swelling that can be reduced without having to do anything else, no other work. I have now made the body more efficient in that local area. I don't see that as a bad thing. My opinion. Moving on, number 2. I'm going to figure out on a scale from 1 to 10 what kind of movement I can do getting my pain to no higher than a 4. So I need to figure out what movement or what stretch or what exercise I can tolerate up to a 4, because it is my belief that when the body starts to hit a certain level of pain, it begins to have neurological inhibition to muscles. This is based on some of the research from Stuart McGill, where if you have the body recognizing that activation of a particular injury is going to result in further injury because it is now a weakened state and it can't handle the loaded volume of intensity that you were trying to place on it, it is going to shift that neurological activation to surrounding neighboring muscles so that you can do what it is that you've somehow decided that is necessary, which is, I'm going to do back squats, even though I shouldn't be doing back squats. It's going to change which muscles become more and less engaged so that you can do the back squats that you're not supposed to be doing. Problem is, as soon as you've done that, you've created some form of compensation. And if you continue to do that, and you continue to have the compensation, that's going to lead to a change in your movement pattern. How do you avoid that? By making sure that whatever movement you do does not cause so much pain that you begin to have that neurological inhibition. Now, I'm not a neurologist, so I can't say that this professionally does happen. It's just what I've researched and what I've noticed about myself, and it's worked pretty well. Number 3, I'm going to get massage. Whether I do that myself or have it done from another professional, I'm going to get worked on. And what really bothers me is that if a practitioner hears that, practitioner of anything hears that, It's like, you should never get massaged. They have instantly let me know about how uneducated they are when it comes to soft tissue work. One of the first things that happens when we get injured, what do? We grab the area. We put our hand on it. What does that do? It increases the amount of surface area, the pressure decreases the neurological stimulus, and it helps to feel less pain. That's just passive massage. That's all it is. Now, if we have someone who is trained, aka me, in how to do massage, that is not going to further aggravate the area, cause further inflammation. In fact, we're going to decrease inflammation, because just like movement, which again decreases swelling because the lymph system does not have a pump of its own, it requires muscular contraction in order to move it. The movement that you just figured out on step 2, which is going to increase blood flow and help with lymphatic drainage, is also going to be repeated with the massage, which is going to increase blood flow and increase lymphatic drainage. So you got a little bit of redundancy going on there, creating further efficiency. Now, that doesn't have to be from a professional, but in my opinion, it should be, because it's not the athlete's job to know how to do it. The athlete's job is to be an athlete. Leave that stuff to us. And then number 4 is that I'm immediately going to have a conversation with my coach about what I need to do to change my programming. I'm assuming that we're talking about athletes in this case. And the athlete needs to have that conversation to figure out what the next 6 weeks are going to look like. It doesn't have to be massive changes, but there will be changes. You should know that right away. The healing process for soft tissue is typically 6 weeks. During that time, you might have an 80% recovery rate or rebuilding phase in the first, say, 1 to 2 weeks, especially if you're getting help. But that last, say, 20%, that takes the remaining time. The body can be really, really efficient. You can get back to function super fast. But that doesn't mean that you're back all the way to full performance. It takes time. And you need to know what has to happen in that time. You might think that you just have a small muscle tweak in your shoulder. You think, that's all right, let's work through it, it'll go away. No, it won't. Things don't just go away. In fact, the reason that it turns into something more is because you had a tweak that you didn't listen to. And the thing that started off as a tweak, it might have only needed a couple of days to recover, turns into a full-blown injury that now takes weeks to recover from. But you don't say anything for quite a while, and now it turns into something that takes months. That's just irresponsible. When all you had to do is, at the beginning of this, sit down, have a conversation with your coach, another practitioner, and figure out, how do I take my programming, and I've talked about this before, and lateralize the exercises so that I get a similar training principle from a different movement, so that once you get back to being able to, say, do back squats, you're not very far behind. You haven't regressed that much because you've maintained strength from a different movement that didn't aggravate the area. And a good strength coach will be able to help you figure that out. And a good practitioner will be able to work with them to say when things are able to be adjusted. And if you're good at communicating as an athlete, all of that happens really easily. But as easy as that is, it's next to impossible if you don't do it at the very beginning. And it's incredibly frustrating for all the parties involved. So again, just as a recap, what should you do? Number 1, kinesio tape. Make sure you're doing it with someone who knows what they're doing. Number 2, you got to figure out your movements, because that's what's going to help you when you have your conversation getting to number 4. Number 3, you need to have some kind of soft tissue work, and you need to know what kind of soft tissue work you should be doing. No, you should not be doing deep tissue on a muscle injury in the first 3 days. That's just irresponsible. Number 4, you got to have that conversation. You got to sit down and have that conversation between you, your coach, and the practitioner, so that you know exactly what you're going to be doing in a strategic fashion for the next couple of weeks.